We spent $4 trillion last year on healthcare. Many of these diseases could be resolved or partially resolved as a result of people doing activity and building lean muscle mass. Now, ladies, if you're watching, this isn't a bodybuilding show. We're not here to try to promote that you go out and build huge muscles and, reduce your feminine capacity. We're really talking about building simple lean muscle. Again, this recommendation is 240 minutes of moderate to vigorous exercise per week. That's less than 7 hours of exercise, actually about 6 hours of exercise a week, so less than an hour a day. Now, how many of you doom scroll on your phones? How many of you spend more than an hour a day in front of a computer screen or watching TV? Take that into context, because less than an hour a day per week, in total 240 minutes, could lead to significant impacts and changes. And again, from 2009 numbers, $150 billion in direct healthcare costs saved. Now, I think the number is much higher. I think if people had lean muscle mass, we would cut the budget, the health budget, by trillions of dollars, because at this point, what have we done? Beyond 2009, we socialized healthcare. We've said that healthcare is a right and everybody deserves access to healthcare. I don't disagree with that, but I also think that healthcare should be defined as prescribed exercise. Doctors are so busy writing pill prescriptions. They're so busy telling patients, take this, have this injection, get this shot, and they're not facing the 10,000-foot elephant in the room, which is the obesity epidemic. People are overweight. Most of the diseases, cardiovascular disease, stroke, diabetes, autoimmune disease, could all be tremendously influenced as a result of some simple prescribed exercises. And insurance, if we're going to say that everybody's entitled to health care, insurance should cover exercise before it covers any medications. In other words, a doctor should be able to prescribe exercise and not drugs, send that patient home for 2 to 3 months and see the outcomes of the benefits of what exercise could achieve. The exercise benefits that would allow for lean muscle mass growth.